Hi everyone, my name is Stephanie Lozon and I did my research on barriers to accessing and continuing mental health treatment among individuals with dissociative symptoms. What is the issue? A clinical research study was done in 2022 by the European Journal of Psychotraumatology to better understand some of the barriers to accessing treatment. The study recruited 276 participants via online social media platforms. These individuals had self-reported dissociative symptoms. They were asked to complete a survey which featured 35 barriers that could impact their access to receiving treatment. Some of the barriers included finances, insurance, and lack of provider availability. The study reported that 97% of the participants experienced at least one barrier to treatment. What does it mean to have a dissociative disorder or experience dissociative symptoms? Someone with a dissociative disorder experiences the loss of connections between things like their thoughts, their memories, controlling their own feelings, loss of connection with their surroundings, behavior, and their identity. Oftentimes, people experiencing this disorder will try to escape from reality in unhealthy ways, which causes problems to their everyday life and concern for their general safety and well-being. The American Psychiatric Association defines three major dissociative disorders: depersonalization/derealization disorder, dissociative amnesia, and dissociative identity disorder. What dissociative disorders did the participants have? So this is a list of what everyone wrote down that they had, including dissociative identity disorder. 121 people said that they experienced that, as well as depersonalization, derealization disorder, 33 people. Dissociative amnesia was 25, and as you read through the list, you see higher numbers for some than others, but a lot of times they were experiencing multiple disorders. This is a graph that I took from the article that I was reading for barriers to accessing the mental health treatment. And as you can see down below, it tells you different barriers that people had, which were insurance issues was one of the highest ones, structural barriers, provider availability, inconvenience, dissociative identity related, negative beliefs about self, poor response from provider disbelief, perception of problem, handle on own, problem severity, others, influence, low perceived need, perceived ineffectiveness, lack of trained providers, stigma, other, and no access barriers. For the method, participants were asked to complete a survey modeled off of the World Health Organization's World Mental Health Survey, as well as literature available on barriers to accessing and continuing mental health treatment provided by the questionnaire. Had several findings. Number 1, structural barriers, financial, insurance problems, lack of availability by the provider, competing needs such as time, low energy, and childcare. Perception of problem barriers. Some people did not feel like their problem was severe enough to require treatment. Some individuals wanted to handle it on their own. And then lastly, perceived ineffectiveness of health treatment that were not captured in the survey. The participants were recruited via social media platforms. The requirements that they had to meet were that they were over the age of 18, must be able to read and understand English, and have self-reported dissociative symptoms. There were a total of 276 participants. 81.8% of the participants were from the U.S., with about 19% of them being from other countries such as the UK, Canada, Germany, Thailand, and Lithuania. As you can see down here, 46% were female. That's 127 of the participants, so most of them were female. 9.78% of them were non-binary, which is 27 participants, and then 27.9% were male, which was 77 participants. So mostly it was female participants. The results: participants had a hard time continuing mental health treatment or had a hard time accessing treatment. The availability of mental health providers trained in dissociation is critically low. Many patients report difficulty finding appropriate care, with some professionals lacking the expertise to accommodate the unique needs of dissociative individuals. These were my critiques of the article, including that there were not all of the disorders were considered in the study, such as panic disorder and borderline personality disorder, which means that the results that were noted may not be generalized to those disorders. The study focused more on people with trauma-related dissociation. They also stated that they used social media platforms, which means a lot of the people who took the survey were already aware of the dissociative symptoms and were already a part of online communities focused on their disorders. There was also a large number of recruits from the United States, meaning the generalizability from other countries is still unknown. The data was also self-reported, which makes the data received based on the individual's own perception of themselves and not objective evidence. Lastly, the survey's psychometric properties were not tested, leaving no formal validation of how well the questionnaire measured treatment barriers. To sum it up, the article holds a lot of valuable information on an issue that is progressively more prevalent in adults these days. Although there are a lot of changes that should be made to this study, one thing is true. There are not enough resources for people with dissociative disorders. And then I have my references to back it up. Thank you guys for listening. Have a good one.